So we want to get rid of the government subsidies because people don't need the government subsidies. You see, what we're seeing right now is under Mr. Ong's watch, the healthcare budget, the amount of money the government spends on healthcare has gone from $9 billion to $23 billion, and that's just simply not sustainable. So we cannot depend. Right now, the 3Ms make up less than 15%, MediSave, MediShield, MediFund, of the total health expenditure in Singapore. The largest provider is government subsidies. And the healthcare was the reason given for the rise in the GST. So it's frankly not sustainable. We can't have GST going up every 2 years, you see. So in order to do that, we have to get rid of the two pillars and stick with an insurance pillar. So it's MediShield Life on steroids, so to speak. And MediShield Life that expands to cover everything. So it's like your car. You get a small scratch, you go fix it on your own, you don't claim insurance. You get something big, you know that you're not going to go bankrupt. You're not going to have to scrap your car. You're not going to have to, do some major overhaul because you have insurance. And that's the principle of insurance, is that most people don't use it, especially the young people. So when you have a mandatory health insurance, you start paying into it when you're young. And when you're young, you don't need the healthcare. And Singapore has the benefit of a demographic dividend, because even though the elderly are only about 20%, that's much lower than in most high-income countries. In Japan, it's like 40%. So we have a lot of young people who are going to be paying into the system, and that will allow the calculations, the risk pooling to work. In fact, it will probably reduce the insurance premiums, and the reason for that is because if you have a single payer, then you can dictate. Again, to use the car analogy, some of them, the insurance companies say you have to go to the insurance company workshop. And why do they say that? Because they control the price at the workshop. So if we have a single payer, then the single payer can dictate how much is the price that they will pay. And we've seen this with some of the procedures. When MediShield covers a certain amount, then the private insurance will not cover anything more than that. Okay? So they are price setters. So in fact, the insurance premium should come down if you have a single payer. And we're not talking about government run. Because ElderShield has got 3 different insurance providers who are running it for the government. There's Great Eastern Income and Sing Life, I think. So the government could easily contract it out. And if you do it on a competitive basis, the insurers will want to get that pie, because it's a huge pie. So they're going to price it competitively. An example I give you is the flu vaccine. So every year, the government buys like 1 million doses of flu vaccine, and they have a single tender. So all the companies will lower their prices in order to get the government tender. Because if they don't get the government tender, they lose 1 million doses. So they make up in terms of volume what they lose in terms of the margin for their profits. So the same thing is going to happen with the open insurance market for a single payer healthcare insurance. If you try and get an appointment for mental health services in Singapore, the waiting time is really long. And this is actually publicly available data. I can't remember who it was who asked this question. I think it was Gerald Giam or Herting Ru. So they asked that question, and the waiting time is really long. But people, what they do is they end up going to private. And the private sector has actually got quite decent resources, except for inpatient mental health care. The large numbers of psychiatrists, counselors who are out there in the private sector. And so if you have the resources, if you have the money, you get really good mental health care in Singapore. But if you don't, then unfortunately you have to join the queue. And while you're waiting on the queue, we've had terrible things that have happened. People have committed suicide, people have had all kinds of issues while they are waiting to be seen in the public mental health care. So this is in line with the National Health Insurance Plan, which breaks down the barrier between public and private. So if you have a national health insurance which can be used in both public and private, then you don't have to worry about the queue. And in fact, it's not impossible. As I mentioned earlier with the dental health, when there was a really long, people used to have to wait 1 year for National Dental Center. So they introduced the CHAS Dental scheme for the yellow and orange and blue card. And you can actually get to see a private dentist. Private dentists will charge you the subsidized rate and will claim back from the government. So there's no reason why mental health professionals cannot do that. In fact, some companies have done that, where they actually provide company medical benefits for mental health, and not just for doctors, for counselors, for psychologists. And so that's kind of what we envisage.